Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. Joining us via Zoom this morning is the husband and wife couple of Dr. Cecilio Eck. He's a well-known pediatrician and a popular face in the health sector. He's also a recovered patient of COVID-19. He is with his wife, Lysette Eck. She too is a recovered patient of COVID-19. Good morning, guys.
Good morning, Sunny and Marlene.
Let's talk, first of all, Dr. Eck, about how you contracted COVID-19 and what that ordeal or that experience was like for you. I know that we were all praying, we were all concerned about your health and your well-being in light of, having caught this illness, and you've made it through, but there perhaps are still some after effects, if I may, of the COVID-19. Talk to us about where you are and how you contracted the virus.
Well, you have many questions in that one bundle together, but let's start with the first.
Mm-hmm.
I am unsure of where I got it, but being in the health sector, we work at HMH, we work privately, we see kids on the outside, and of course, like me and you, we go to the store, and so it could be anywhere.
Mm-hmm.
I maybe could narrow it down to a couple of patients who came in, was seen by me at my clinic, were sick with cough, cold, flu symptoms, but didn't need to be admitted. So I gave my medication, I sent them home, and I told them, contact me in case of anything. But of course, unlike me and you, when we examine a child will literally sneeze in your nostrils. So there were maybe 3 or 4 kids who had come in like that. Mm-hmm. So I kind of pinned it down to that. And despite our usage of face masks and the rest, you're still vulnerable.
Yeah.
I think that's such a great lesson in realizing that COVID is very determined to find a host body, no matter how much prevention you actually take. And as you pointed out, knowing the exact source is difficult. Tell me a bit about what it was like when you found out, what symptoms you had to make you realize that you did have COVID, and what that experience was like.
Well, initially it was just a cough, cold, flu, a simple illness.
Mm-hmm.
But because we are responsible healthcare professionals, whenever we have any symptoms like that, we'll have to go and do our swab, check ourselves in at the hospital. Because if it is COVID, we don't want to spread it to our patients who are admitted.
Yeah.
And so I went and I did the test, and it was positive. My wife was ill as well, and so she tested and she was positive as well. And so we quarantined at home. The only one who was not positive was my little daughter, Rianne. And I don't know how she did not get it, but she's the one that stays at home, locked up in her room, goes to SCA online, and has little contact with anybody anywhere.
Yeah.
So while you were... Sorry, go ahead.
No, so I'm just explaining that was the dynamics of how it first started.
Mm-hmm. Yeah. So while you and your wife were both quarantined, your condition got progressively worse over time, correct?
Yes, for the first week, it was okay. I did well, took my medication, got the little fevers and a headache, and I was doing well. But as I tell everybody, my wife forced me. I said it was a pact, but it was basically a threat that if it would get worse, if I felt in any way getting iller or sicker, I would have to report it to her. And that happened. I started to get shorter, but I could have hidden it I did some nebulizations to try and see if that would help because I'm asthmatic. But when that did not work, then I told her, yeah, it's time for us to go.
Yeah. Lysette, what was it like on your end? You knew and I want to say very clearly, because you've already said it publicly before, your entire family is fully vaccinated. So
Yes.
you go through the process, the first couple days with COVID, it seems like it'll just be a cold. But what's it like on your end, knowing Dr. X's pre-existing condition?
Well, to the beginning, when we tested, it's actually the three of us. He, myself, and my older daughter, the three of us tested positive. It was only the younger one who wasn't positive. So what we did is we quarantined her in her room, and we roamed the house and gave her food and water and helped her with whatever she needed. When he decided, or when he told me that he was sick or I needed to go to the hospital, I drove him there and I told him it's gonna be okay, and came back home with the kids. And we were still quarantined, just me and my smaller daughter was quarantined, and me and my older daughter, stayed outside. So that was the rough part, having her by herself during this time, and then just the two of us together, and then him in the hospital. So that was a bit rough.
Yeah.
What was it like for her, though? I mean, if you were able to kind of relate to us, perhaps what she was dealing with. I mean, she's in isolation or quarantine, and you are sick with COVID. Dr. Eck is hospitalized with COVID. That must have been quite an experience for her as a teenager.
Yes. I believe it was, and thank God, a lot of her friends got in contact with her online, and the parents and the mom, and asked how they can help.
Yeah.
And all I ask is for them to keep, talking to her online, cheering her up. And a couple of them went out their way and brought goodie bags for her, dropped it off at the gate for her. Yeah. So in that way, she was still in contact with her friends, and she still felt a part of their group. So I'm so thankful, for friends like that, and family who even did the same. Yeah. But it was rough, I think, on her.
Of course. I can't imagine. Can I, at what point it was day, 7, 8 that you were hospitalized, Dr. Eck, and what did they find when you were admitted?
Well, at day 7, I went in, and it was a pneumonia. It was spreading rapidly, and that is what curtailed my oxygen concentration in the blood. And that is why I needed the oxygen, the high flow oxygen. So they started me on that. But what I tell people is the literal truth. I remember my wife dropping me off with my good friend, Dr. Alberto Aguilar, at the A&E. And that's the last I remember. The next thing I remember is waking up in the hospital. So
when you recovered.
People ask me what was happening in the ward, and did I see anybody? And I have no recollection of that. It was, it's, I think, hypoxia or oxygen starvation, when your body is like a fish out of water, dying while trying to live, and concentrating on that. Everything else is, just by the way.
Yeah. And that, Lysette, I can say from personal experience, that experience of dropping someone off to the hospital with COVID, it's very traumatizing because you know the odds. So
yes.
Tell me a bit about what it was like for you to hold it together at home, one child in isolation, one child still sick with you, and you still have COVID and you have to monitor yourself.
Yes, Marlene. That was rough.
Yeah.
That was rough. Because at the time, yes, I was still sick. As a matter of fact, I think that Saturday that I dropped him off, I probably felt the sickest that day.
Yeah.
So coming back home, trying to myself recover and take my medications on time and eating right and taking all the herbal teas and whatever people were telling us to drink. It was a bit rough. Thank God my older daughter that got it, she only had it for about 2 to 3 days, and she was recovered after that. She was feeling fine. So she was the one running the house and helping all of us after that.
Yeah.
Yeah.
Yeah,
And waiting on that daily update from the doctor as to his.
That's the hard part. You feel like you're sitting in a chair watching the clock. Sometimes you try to distract yourself and watch something else, but the clock just not moving. It's just ticking minute by minute, and you don't see the hours or time going, and you're just waiting on that phone call.
Yeah.
Yes, that was hard indeed. And I must say, I have a third child who is in Belize. He's living in Taiwan, so communicating with him as well, you know, keeping him up to date. That was hard as well. I think the hardest part was the day when he was ventilated the first time. And I got that phone call and I had to tell my kids. At that time, Rianne was still quarantined in her room. Tyler was in Taiwan, and it was just me and Kayleen together. And everybody's crying, and I can't console the smaller one. The older one is away. You know, that was hard. That was hard.
Yeah. It's when you hear the daily updates and you start to see, I mean, it's a roller coaster. It's like one day a good day, or not a bad day, and then a bad day, and you're up and down like that. I think people don't understand the severity or the trauma in this experience. You had people across this country praying. I know you relied a lot on your faith, but how would you explain what it felt like, that period of his hospitalization, for you as a mother and a wife?
Like you said, Marlene, first off, I feel like a nightmare. And secondly, like a roller coaster, but a very steep one that keeps going up and up and up, and you wonder when it would reach the top and start coming down back. Because it was just one thing after the other, and it felt never ending. Like, when will it stop? When will he reach a peak and start recover? And that was very hard, you know. Day by day, you go to the hospital and you hear something else. You go again and you hear something else, and it just keeps rolling and rolling and rolling, and feels never ending.
What has the recovery process been like? I know you're well on your way to a full recovery, but what has that part of the journey been like in terms of trying to get back to some sense of normalcy within yourself?
Well, it has been rough for me because you go from, well, I had a lot of comorbidities. I have asthma, diabetes, and hypertension, and I'm fat, I'm obese. And so all of those are the worst things to have with COVID. The worst one would be age. The older you are, the more vulnerable you are. But with all of that being said, coming home, being discharged after the operations and after everything else, the recovery period has been rough. For the simple fact that I can't move. I can't move I can feel sensation. I can move my lower limbs and the small muscles, but the big muscles that would move me, that would make me stand or turn in my bed or reach for certain things, the power is not there, because for the 12, 14, 15 days that I was intubated and they give you medication to immobilize you, to prevent you from pulling out the tube from your throat. That causes atrophy of the muscles. So the muscles literally start to disintegrate. And so when you come out of a induced coma, the main issue now is to try and get moving.
Yeah.
And that's where the physiotherapist comes in. So to answer your question now specifically, the roughness of it is the physiotherapy. Because my beautiful physiotherapist, I call her my beautiful torturer, Miss Trejo, comes in every day. And before I used to hug her up and say, "Hi, Mish, how are you doing?" Now I cringe when I see her because I know for the next hour it will be work.
Yeah.
And it's simple things to do. It's not if you would sit and do what I do, you would laugh. But for me, by the time she's done with me, I'm soaking wet with sweat. But the last statement has to be that there is progress. I have come to the top of the proverbial roller coaster, and now I'm on the mend. I'm coming down. Slowly but surely, the muscles are coming back. They're getting more and more healthy. They're growing back again with the muscles, with the exercises that she gives, and it's been good. Another big issue though is simple issues like self-hygiene, like getting a drink of water, like getting food, getting the remote to change the TV. I can't do any of that right now.
Wow.
I need somebody to help me with it. And going from being very active and being very independent and self-sufficient to somebody that's totally dependent on others, you know, it's very humbling. And that's where your faith comes in.
I can't imagine. When you hear, Dr. Eck, the stories, or as your family replays for you how things unfolded, when you were finally at home, what was that experience like for you?
It was, and it's still pretty strange because the way how Lysette explained it to you just now, I didn't get that part of the story. So there are snippets of the story that are still, I don't know. And as time progresses, I find out, oh, she did that, she did this. I was speaking with my little daughter yesterday in the evening, and I said, so did you cry or anything? And she said, Daddy, I cry every day when you were in the hospital. And she's usually the tough one.
Yeah.
So, you know, how it unfolded is still parts of it an enigma to me. I'm still not sure what happened. I'm still not sure all the small pieces. So again, to answer that question in a real way is when I awoke the second time, the tube is in your throat, so you can't speak very well. And I was asking them, date. And nobody in the room could understand what I was saying. So they gave me a pen and a pencil and I put, what is the date? Because I was unsure.
How long you'd been under?
2023.
Yeah.
I'm not sure how long I was under. So when I gave them they said, oh, the date today is so and so and so.
And then you realize how long it's been.
How long it's been, how long I've been under, how many days were lost. Yeah.
You know, I think one of the things that's a big part of your story is just how tough it was for you to beat this disease. You talk of being intubated twice, having massive bleeding, requiring major surgery to be able to address that. And even while you were intubated, I know there was a call for blood as well. So, I mean, it's recognizing how close to death you were. Is that something that you think you've internalized as yet? I'm sure Lysette has her own story as well.
I don't think I've come totally to grips with it as yet. I do know that I'm in the maybe top 0.0001% to have survived, because with the first intubation to deal with the lung, that went okay. With the internal bleeding, I remember the doctors coming in and saying, do you feel pain? And maybe for a day or two, I said, I feel a little thing over here. And then when it started to get worse, that's when they went and did their ultrasound and found out that I had a bleed. And then, as I tell everybody, our health system in Belize, even though everybody argues a lot, all groups from all sectors came together and made a decision whether or not to go in. And that included people like Dr. Paguaga, the main surgeon, Dr. Arriaga, the internist, Dr. Gutierrez, the other surgeon who went in, Dr. Koi, Dr. Johnson. I even had my obstetrician to look after my uterus. Dr. Nicholas, Tracy Nicholas, she said my uterus is fine.
Okay, good.
The too numerous to mention, Ellington, LaRue, those are the anesthesiologists. And all of them sat in a group, discussed the pros and the cons in going in, and then decided to do the surgery. So my point with it is that in a case like this, that's maybe a little bit more complex than the regular cases, this is maybe the only country where I could get the public, the private, the people who work independently to get together and make a decision, and the collective wisdom of any group of doctors is exponentially greater than any one or two doctors alone.
Yeah.
So I think that decision to go in, find the bleed, remove the clot, they popped it with some gauze, and then a couple of days later they went in, removed that, and checked for any more bleeding, and I think that's what saved me.
Yeah.
For anybody else who did not get done, they wouldn't be here today. I wouldn't be here today.
Yeah.
And Lysette, what's it like from your point of view when I imagine the triumph, the relief you feel when your husband is taken off the incubator the first time, and then you're faced with this decision next?
Yes, indeed, Marlene. During the first week after he came off, he was recovering, we thought fine, and we were all happy and looking forward to him to be discharged that same weekend. But by the end of that week, we noticed that he was starting to get paler and paler. He started to complain with the abdomen pain, and so they decided to do some more tests, and his blood count was falling. So they realized, or they suspected there was bleeding somewhere. So that's what prompted them to go and check. And it was a CT they had done to confirm it. And the following day, when they had the collective meeting with all the doctors, I remember they coming back in the room and telling us their decision that they'll have to go in. And I thought to myself, well, this might be it. And I remember praying, because I'm a very prayerful person. I'm a Christian. I believe in God. I believe in prayers, and I believe in miracles. And we've been praying from the beginning. And I remember speaking to God at that moment, and I said, Lord, if it is your will, let your will be done. I know the doctors are making a decision at this moment. You guide them. You give them the wisdom. Let them make that right decision. And so when they came and told us that that's the only choice we have, that's what they want to do, and he was aware at the time. He was awakened at the time, and he knew what was going to happen. And I looked at him and I asked him, is that okay with you? And he said, well, if the doctors are saying yes. And he was the one that signed the consent form at that time to do the surgery. He wanted to do that. So, yes, I was scared, but at the same time, I was comforted, because I had already prayed about it, and I knew that decision was from God, whether they did it or not. And so that is what brought me comfort at that time, and to go through the rest of it. And of course, yes, it was scary, taking him to surgery the first day and just waiting those hours, just clock just ticking, waiting to hear just a phone call, And when it first came, I think that's the first time I literally cried, because it was tears of joy.
Yeah.
So yes, it's heart-wrenching. You don't know what to expect during those hours, those moments, even after the surgery, because he came back out intubated. And then 2 days later, they went back in a third time, and he came back out again, the same, intubated as well. And that one lasted, I think, 7 days. Intubation was the second time. And so I know, maybe being a doctor's wife and we talking a lot, I know the risk of this. I know the risk of being intubated. I know the odds of coming off. I know the odds of him coming off well. And so all of this, I started to recall and think. And again, I prayed and said, God, if it's your will, whatever you decide, we'll accept. And that's how it went. That's where I got my strength from the whole time, from my peers and everyone that was praying for me. I think literally the whole country and even abroad. I have people calling to pray with us from the States, from the Caribbean, all over, people I don't even know. Yeah. So I think that's where I had gathered my strength from the people who were praying with me and just supporting us in every and any way, because we had, up to now, lots of support. Yeah. So that's what carried me through.
Dr. Eck, I know you've mentioned your comorbidities and what have you, as well as the fact that you are also vaccinated. Do you believe that you being vaccinated played a more critical role in you being able to survive this particular ordeal?
Yes. That's a simple answer. The correct answer would be that I was 1 week away from getting my booster. Mm-hmm. Because in between the first two and then the booster, there's a time frame. And I was literally, the following week would have been when I would have gone for my booster. Yeah. Without the vaccines, I would not be here. The vaccines actually primed my system to fight this virus. And I think maybe that's the reason why I'm not that short of breath, because they help. The antibodies that were there were triggered to fight. But this new variant is pretty resilient. Yeah. And I think that's what put me in my dire straits.
So let's talk about the happy ending. I know we spoke a lot of the challenges and the tough times, because it was. And I can only imagine, and I'm glad that you pointed out, Lysette, just the support and the faith that you had that got you and your family through it. But let's talk about that moment when you were able to come home. What was that like? I saw the video of the staff there at healthcare clapping you out. What people don't realize is that the medical staff is just as happy as the family, because they have been able to successfully treat someone. What was that like for you guys?
Well, for me, I was very thankful. The people at Healthcare Partners, I remember most of my nurses. I remember Nurse Caetano, Nurse Eliani, and Nurse Latchman. There are a whole group that they looked after me, but they also cared. Mm-hmm. So if I needed anything, they would come and help, or if I needed help with anything, they would be there. And they were always positive. They were saying, yes, doc, you'll be fine, we'll do this, and you'll get over this thing, you just need to be strong. And they come and comb my hair, and they're not trying to lift your spirit. So I tell people nursing is very, very, very hard work. It's not only changing a bedpan and putting up an IV, but it's touching your patient, combing their hair, talking. So I have made very good friends just being there. We know about each other families now. Mm. And so when we leave and it becomes a success story for them, they are thankful. And not to be a downer, but the reverse is true. And a lot of people don't notice that when a patient dies, it's devastating on the staff. Yeah. And it's devastating on the attendants, on the PCRs, on everybody who works in the unit. Because it's a loss to them, it's a loss of one of their family members then. So when we leave, and it's a success story, they line up and they clap. And I think for me that kind of brought a few tears to my eyes, because it means that it's not just a job, it's a calling for them.
Yeah. And for you, Lysette?
For me, it was bittersweet. I was happy, ecstatic that we'd be home and, we continue this journey. But at the same time, I know that it's another phase had begun, and that phase would be solely dependent a lot on me, because I had to get ready a room specifically for him to be comfortable in, with a hospital bed that would be able to move him up and down because he can't move. Just getting the room in order, getting the oxygen, getting all the monitors that I needed to do his vitals, getting nursing staff to come in daily to help, attendants to help move him during the day, because I can't do that on my own. So I know I had a lot on my plate while he was coming home. So it was bittersweet. I was happy, but at the same time, thinking about all I had or would have to go through in this next phase.
Yeah.
So that's, yeah.
And still, as we see, you are still in that recovery process. As you pointed out, you're doing daily physical therapy as you try to build back the muscles. But what do you want? Sharing your story today is an opportunity for people to hear what it's like to have someone with severe COVID or go through severe COVID. And it has a positive ending that so many people long for. But what do you want people who are watching to understand about this experience, and why they should use it as an example of taking all precaution, all care when it comes to COVID-19?
Well, I'm Dr. Eck. I'm trained to not contract viruses. And for many months, I visited the COVID unit, not to fast from people, but I used to take donuts for the staff. And a lot of people used to look at me and say, why are you going there? You don't need to go there. I say, yes, I need to go there. I would want everybody in the hospital to gear up, go down there and see what is happening, so I understand the gravity of the situation. Because in the past, it used to be just a little offshoot, and only the workers would go there. So if Dr. Eck trained not to get sick, not to get the virus, got the virus, became gravely ill and nearly died, it should be a warning to people out there to do the preventive things. It's not hard. Wash your hands, wear your mask, do your social distancing, obey the curfew laws, vaccine. If there's a booster available and you're up for it, go and do it. It will help you. It will prevent it. It will prevent you from going through what I'm going through now. And what I'm going through now right now is not nice. It is, I am very thankful that I came out with all my cognitive abilities intact. A lot of people come out with issues, with movement issues, that's cerebral palsy, with blindness, deafness, problems with cognition. Maybe they can't understand or remember different things. But because of that excellent team at BHPL, because of Dr. Puar, he helped as well, I came out intact, and I gave thanks for that. But it is totally preventable if you follow the rules. Only the frontline people like myself should be exposed and should get this thing. The other people out there, you don't need to get. Just follow the rules. The second thing that I have to say, I was scolded by my mother-in-law yesterday because she said, you always talk about the doctors, Dr. Eck. I want you to mention Lord. So I have to give thanks as well to the Lord and to the prayer warriors out there. Those are the architects, those are the people he's the person that guided the hands of the doctors that cured me. And I have to give thanks to them. I have to give thanks to Dr. Pagwaga. Every time he sees me, he walks up to me, puts his hand on my head and says a prayer in Spanish. And the only part of the prayer I understand, because I don't speak Spanish well, is Dios. But he says it in a very commanding voice. And I think I love him for that. He's an excellent doctor, but he's guided by God, and you can't go wrong that way.
Perfect.
And for you, for you, Lysette, what's your advice to people?
Well, I'd say the same. Wear your mask. Don't take it off unless you're around the people in your own household. I keep seeing friends and acquaintances still out, with people outside their household, not wearing a mask, still going out, taking a drink, having a dinner. And every time I see it, I irk because I know what I've been through, and I wouldn't want that for anyone else. So wear your mask, wash your hands, avoid being out if you don't have to be out right now, and just stay within your household. That's what I would advise.
Well, thank you both for sharing your story. Dr. Eck, we are happy to see you, and I know that you have a bit of recovery ahead of you, but we have no doubt, just like you got through this this battle with COVID-19, you'll get through the physical therapy and be back on your feet, literally. And Lysette, thank you for sharing what the family's perspective was through this, and being open as to that experience as well. You both continue to... Go ahead.
I just wanted, before we go, I have to thank some people.
Yes.
I know it's too numerous to mention, but just a couple by name that I have to mention, if you would allow us.
Go right ahead.
Dr. Arriaga, Dr. Hidalgo, and Dr. Cuero, who are his main physicians involved in his case. Dr. Morejon, Dr. Paguaga, Dr. Gutierrez, Dr. LaRue, Dr. Ellington, Dr. Johnson, Dr. Coy, Dr. Nicholas, Ms. Rocio Hiron, the respiratory therapist, Michelle Trejo, the physiotherapist, all the nurses and staff and attendants at BHPL who were excellent. Care was very good. We also needed to thank the staff at Carl Hushna, Dr. Cruz and Dr. Bradley, and all the doctors and nurses who took care of him during that time. We have to thank everyone who donated blood to him. I mean, that was another drive, I think, that overwhelmed the system, because people told me that they had to be turned back. And some of them had quarreled with people at the blood bank because they told them to come back. So I just needed to thank those people, whoever donated blood for him. Thank you so much. All his patients and friends, parents who sent voice messages or prayers, recordings to him. I needed to thank our cousin Venetia Eck, who started a Zoom prayer meeting when he first got admitted. Initially, it was just with family members, and we prayed the rosary every single night while he was hospitalized for 30 days. And by the end of that 30 days, that group had grown to over 80. And we were praying for not only ourselves or my family or for his recovery, but we were praying for everybody who was afflicted with COVID or recovering. I needed to thank more prayer warriors from every prayer group, because I know it was a lot of prayer groups praying for us. I'll have a lot of friends, acquaintances, and even some people we don't even know who have graciously donated to us for his medical cause, his continuous medical expenses, I should say. Yeah. Thank you so much. And I have a lot of other groups as well who have been organizing different fundraisers on our behalf. I needed to thank them as well. And the first person I should have thanked is God for getting us through this. He's the main one behind all this. And I know that he has a purpose for our lives. And that's why we're here today, him especially. And yes, I needed to thank God for giving him a second chance.
Well, thank you both for sharing your story. And I think that extensive list, Lysette, shows just the army of people. You know, they said it takes a village. That's what it took. And we thank you for coming on and telling us all about it. You two continue to stay safe and keep up with the PT, Dr. Eck. Don't give trouble.
No trouble.
All right, and we
I'm
hope.
I'm glad for my big scar because they say scars build character.
Yeah.
So I have a lot of character now with my huge scar.
All right, thank you both. And with that, we're going to go ahead and take a break.
And when we come back, we're going to be discussing with the captain of the Belize Coast Guard as well as Lieutenant Commander about the 16th anniversary of the Belize Coast Guard. Stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.